Hello, I'm Jessica Escobar. December 2018, I was placed at St. Francis Memorial Hospital in the Community Services, Volunteer Services, and Emergency Management Department. To start out, I would like to introduce myself a bit more. I was born in Nicaragua, a country located in Central America. Then I came to San Francisco, California with my mother and twin sister when I was 5 years old. This upcoming fall, I'm going to be a senior in men's college and all-women's private college in Oakland, California. I'll be double majoring in public health and public policy. One of my internship projects was to conduct inventory assessments of the triage medical supplies and decontamination supplies we had stored in the emergency department and in the storeroom. My second project was to write 2 stories showing the impact the Tenderloin Health Improvement Partnership, TOHIP, has had on the Tenderloin community. These stories are going to be published in the St. Francis Foundation website. Using a platform called Live Stories, I had to create charts and graphs to show relevant data about the Navigator program and their goal to reduce readmissions rates in the ER by connecting patients to community resources and getting them follow-up care appointments at their closest clinic with primary care doctors. Secondly, I'm in the process of writing another story about the Tenderloin Museum and their goal to share the resiliency of the Tenderloin community since the 1900s through their exhibits, events, programming, and tours. Lastly, my third project is to assist in the planning of the Giants Race Marathon. My job is to make sure that we have all the supplies we need for the Giants Race event happening in September 9th and to make phone calls confirming the assistance of volunteers for that day. This slide shows a more detailed view of what I did. I made visitor badges for everyone who was coming into the hospital that is not staff. I worked on the patient navigator story. I took inventory, and I also went to a lot of meetings with my preceptor. One of those meetings was a working session event where many stakeholders and CBOs were invited to put their heads together and think about the ways their organizations can help improve the health of people living in the Tenderloin, a district in San Francisco known for its large homeless population and where many low-income refugees and immigrant families live. I was tasked with the job of collecting all the feedback that was discussed, analyzing it, and consolidating it all into a summary report. This summer, I was able to conduct 15 informational interviews with staff from different departments of the hospital and even from other health professionals at other sites. Some of the most memorable interviews were with jobs in infection prevention, quality control, physical therapy, epidemiology, ER social work, and ultrasound sonography. Because of those informational interviews, I was able to narrow down my interest into 3 potential public health careers. Those are community health, like working for a health organization, community-based organization, or a nonprofit. I'm also interested in epidemiology or public health research. And lastly, public health nursing also seems like a career that I would be interested in pursuing. I would like to thank my preceptor Anne and Jennifer, who I also thought of as my preceptor, for providing me with a great introductory internship experience in public health, and for all the staff I came across and those who I interviewed were both kind and helpful to me. I'm looking forward to figuring out my authentic public health career, and I'm thankful for the opportunity this summer.